spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yunji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser. This episode of Spotlight Hawaii is brought to you by Chaminade University.
Well, aloha and good morning. Thanks for joining us here on this Monday morning. I'm Ryan Kalei Suji, joined by Yunji Denise, and this is Spotlight Hawaii on the platforms of the Honolulu Star-Advertiser. And Yunji, this morning we're going to be bringing back a guest that was very popular last month. We had a lot of questions and really excited to dive in deeper today.
That's right. Back by popular demand. In fact, the day we had this guest on, we got so many comments to book him again that we did it right away. We're bringing back Dr. Tim Brown from the East-West Center. He, of course, is a senior fellow there and an internationally renowned epidemic tracking expert. So someone that we really need right now. Good morning, Dr. Brown.
Good morning, Yunji and Ryan.
So good to have you here this morning. The state is reporting today 117 infections, sad to report also 4 deaths. A far cry, though, from where we were just, 5-6 weeks ago. So from your standpoint, where are we in the epidemic here in the islands?
I think, the situation is definitely improving. There's very little question of that. We're coming down from the peak that started in early July, peaked about a month and a half later, and now is very much on the downswing. My hope is that will continue in the near future, and I would attribute it to a number of different factors. First of all, vaccination, I think, has been the biggest factor influencing this. We're up to about 70% of the entire population vaccinated and almost 92% of eligible adults vaccinated at this point. That 30% is the unvaccinated adults, and then also children who are not yet eligible for vaccination. So, there's still a gap there that hopefully we can fill once the vaccines for children are approved. But the vaccines have done an incredible job, I think, of reducing the rate of transmission within the community. And so I think that's the first thing. The second is there have been a lot of infections because of this spike among those who are not vaccinated. Okay, and so those people have attained at least some temporary immunity through natural infection. And we've seen about 50,000 of those this year that might still have some immunity. And the real number is probably closer to 2 to 3 times that. So again, that's a big chunk, probably another 5 to 10% of the population that pretty much is not susceptible right now. They may become susceptible again in the future, most likely will. I think among the unvaccinated, I do think our school programs seem to be working. I think there's some positive news there. If we actually look at the Department of Education reporting on COVID, the numbers have been coming down as reported to schools. And I would attribute that probably partly to the more extensive testing they've been doing at the schools, which certainly helps to get children who are infected out of the classroom and helps to protect others. Safe access, I think, has been a major step forward. A lot of the infections we were seeing before were those clusters related to places like restaurants and so on. Those, if you actually look at the cluster reports, have been coming down pretty much since safe access was implemented. We only saw, I think, 1 cluster on Oahu in restaurants, whereas in previous cluster reports, we were seeing anywhere from 5 to 8 clusters in a typical report. So again, I think safe access has contributed to that. And then finally, people continue to mask here. I think most people are still fairly good about masking. And I do want to stress that in the face of Delta, it's not just vaccination that's necessary, but we also need to keep using our mask in public spaces, because vaccination alone will not necessarily stop the transmission of Delta. It's that contagious a virus. So I think those are factors that have made a big difference in terms of where we are right now.
One of the things that we also heard last week and in the past few weeks from leaders and government officials is the easing of restrictions that were put in place to combat those numbers and what we have been seeing with the Delta variant here in the islands. How much do you think the easing of restrictions will play into what we're seeing now? Are you at all worried about these lifting of restrictions, these gathering sizes going back up? Or do you think that we are as you said, at a good vaccination rate, and those natural immunity numbers are stable enough to contain that?
I don't think that they're stable enough to contain it by themselves. I think that, as I mentioned, the possibility of breakthrough. Our vaccines are currently 65 to 75% effective against Delta. I mean, that's the latest systematic review that just came out a couple of days ago and was estimating that. So there is still a significant possibility of breakthrough infections even with the vaccination. Also, there is still a large unpopulated vaccination. Remember, 30% of the population is still unvaccinated. If we remove another 5 or 10% for natural infection protection, then we're still looking at about 20% of the population that's still susceptible. And that's going to keep the virus circulating in the community, which means it's going to be waiting around, looking for opportunities. And so if it finds a large group of unvaccinated people who are gathering together and it infects one of them, it will quickly spread to the others. So I do think we've got to be very, very cautious going forward in lifting our restrictions. I think the first step that the mayors and the governors have taken of, lifting the restrictions somewhat, for example, allowing participants at outdoor games, but with vaccination and with masking, I think is a step in the right direction. Okay, then you need to scale that up more gradually, so that you're not totally filling the stands immediately. Let's do it a step at a time. Wait a couple of weeks, see if that affected the community situation. If it didn't, then we can move to the next step. But the worst thing we could do is just lift all restrictions overnight. That's what the UK did in June, and they saw a massive spike due to Delta. And it was just stupidity on the part of Boris Johnson's government. But they've done a lot of stupid things throughout the epidemic, so I'm not too shocked at that. But lifting the restrictions all at once, I think, would be potentially very hazardous. That could lead us to another spike, and we want to avoid that.
I want to touch a little bit on what you just said about Delta sort of finding pockets. I think there is a perception in the community that Delta has sort of burned through the community like a wildfire, and that there's no more grass left to burn, if you will, to stick with that analogy. Tell us about that. Could we see another Delta surge in Hawaii?
I think we could see another surge, although my guess is it would be more gradual than the previous surge. It will occur at a slower rate, grow more gradually. So it'll be something we can monitor and track, I think, fairly well, as long as we keep up our testing and basically reporting the data so that people know what's going on. The good part, and I think the really important part, is that the vaccines and this natural infection among those who've gotten infected have largely removed the possibility of severe illness and death. It is still there for some people. For the elderly, it is still a risk. I think, it's very important to recognize that even though we have almost universal vaccination among the elderly at this point, something like 60% of our deaths are still in people above age 60. So it's, it is still definitely affecting the elderly, even if they are vaccinated in some cases. Now, it's at a much lower rate than it would have been without the vaccinations, but there is still some risk for our elderly population there. So I do think we have to be careful. It's also important to know that to follow with your grass analogy, the grass is growing back. Okay, it's important to recognize that. Even we know that vaccine immunity wanes. Okay, that is very clear at this point. I mean, there are so many studies at this point that have demonstrated that. And in fact, most people are now attributing the lower effectiveness of vaccines against Delta more to the waning of the vaccines in terms of their protective ability against infection than it is to the virus itself. And that it's really the weakening of the vaccines over time. And that's why we've now recommended boosters, especially for those who are immunocompromised and elderly, because that will get their immune system back up to the point where they're probably going to get the 90-95% protection against infection that they had before when they first got vaccinated. Okay, so as opposed to the 65-75% that we're seeing now among people who've been vaccinated for an extended period of time. So, that's a possibility. That waning of immunity, if people do not get boosted, then it expands the pool of susceptible people. Similarly, those who are naturally infected, not everybody who's naturally infected gets a big antibody boost. I think that's an important thing for people to realize. If you have a relatively mild infection, something like 40% of the people don't see much of an antibody boost. They get some immunity, but it's far from perfect. Other people do, who, especially with those more severe infections, have a very big boost in antibodies, and they'll be protected for a longer period of time. And what's really happening is as the antibodies are reducing over time, your risk of infection is going up. That's because, the antibodies are part of what prevents the infection from taking hold in your nose and throat. When those decrease, then you become more susceptible to infection. But what's protecting you against illness and death is basically your memory B cells and your T cells that are another component of the immune system. And those basically are staying strong. And that's why even after extended period, we're not seeing a drop in the protection against hospitalization and death. Okay, so people still are protected against illness, even though they may become more susceptible to infection, but generally that infection will be milder. As we've noted with breakthrough infections, they're typically mild. Many of them are asymptomatic, so they don't even know they're infected.
There has been a lot of debate about the Safe Travels program here in Hawaii, its effectiveness, and how long it should continue on. We have a question here from Heidi who's asking, do you believe that we should keep Safe Travels in place through 2021 and into 2022? With knowing how this disease has mutated over time and just the threats that it has, do you believe that Safe Travels is effective? And do you think that it should continue on beyond just this year and going into next year?
I think Safe Travels has been effective. I think it has helped to keep some infections out of our islands. As we've seen, probably the majority of travel-related infections are those people who are returning to the islands, returning residents, who come in and then violate quarantine or basically don't adhere to the restrictions they should here. I would keep Safe Travels in place at the minimum through the holidays and probably even going forward beyond that. I would recommend, that we require vaccination. And, I can't say that the government's going to move this way. I hope that, they've moved this way on international travel. All international travel to the United States now requires a vaccination, but at least, a complete sequence of WHO approved vaccine. They also require pre-flight testing. And I would hope that, we kind of keep those components of Safe Travels going forward. Right now, we don't have the pre-flight testing if you're vaccinated. I think it should be reinstituted, frankly, because I think it's another protection that reduces the number of infected people who get on the airplane. And with Delta is very contagious, so I do worry about that. So I would hope that we maintain it, in some form moving forward, because I do think it helps to protect us.
I want to ask you, the last time you were on, we focused heavily on Delta, but there were some other variants that were in other parts of the country that we touched on briefly. Are there other variants on the horizon that we should be tracking right now?
Right now, there's not a whole lot that I'm worried about in terms of what I see in the literature. The press is picking up on different variants and kind of blowing them up and making a big deal of them. But what you really have to watch with the variants is you have to watch their competitive advantage against other variants. Okay, so right now, with Delta being the king of the hill, the real question is how well do those variants compete against Delta? Okay, the Mu variant, for example, got a lot of press about a month ago. Okay, Mu is one that really pretty much seems to have started in South America, was predominant in places like Colombia and Ecuador. But if you actually look at those countries now, Mu is kind of getting squeezed out by Delta even as we speak. If you actually look at the cases over the last month or so, Delta is growing and Mu is decreasing. So Delta definitely has a strong competitive advantage against Mu. We've not seen Mu take hold anyplace else where it basically has gained entry. So I'm not too worried about that one. There was another flash in the pan, B1630, that a university in Louisiana detected several cases of. Again, no evidence that this has spread any further or that it's really a problem at this point. I think the main variants we're worried about right now are the variants, I should say subvariants, that are coming off of Delta itself. Okay, and in fact, just this morning, CNN is now raising the flag about a variant called A.4.2 of Delta. It's basically a subvariant of Delta that seems to perhaps have maybe a 10% competitive advantage over Delta. It's not the kind of big jump that we saw from wild type to alpha or from alpha to Delta, but it might be enough of a competitive advantage that it eventually takes over, but it's not going to change the calculus. I think in terms of the overall picture, it's not wildly more contagious than Delta, at least in preliminary studies. It bears watching, and it also needs to be better characterized in terms of its possibility of doing vaccine breakthroughs. We don't know that at this point. But I think right now, any of the variants that are out there bear watching, but we don't need to panic. There will be warning, there will be time basically to know what's coming. And what I'm going to say on that is don't rely just on Hawaii variant typing, because we have a relatively small sample. We've collected less than, I think, 5,000 samples over the entire time we've been doing any sequencing here. What we need to be watching is the larger systems like the UK, where they actually sequence about 50% of their samples, the national system in the US, which gets a larger set of samples across the country. In those systems, we could watch the coming of Delta. Okay, for example, we watched it grow in the UK. Then we watched it spread across the United States as it grew to prominence across the United States starting in July. Or sorry, not July, but started more like April, or not, more around June. And then it spread fairly quickly after that. So we will see it coming, but I don't think we'll see it in the Hawaii system directly until it's here. Where we will see it coming is from other places. The tracking that's being done there, the molecular epidemiology that's being done to sequence the virus, that will be our early warning system. And so we need to pay attention to what's going on beyond our shores, not just to what's happening here.
I want to circle back to talk a little bit more about booster shots. And you were speaking of the waning of the vaccine over time. And when we think about how long it's taken us, about a year, to get this percentage of the population vaccinated and fully vaccinated, are you at all worried that once we start talking about booster shots and the need for booster shots moving forward, that some people may not want to get this booster shot, and it may take longer for us to get have people get that third shot when needed? What do you think the future looks like with the booster shots, and what could happen if people decide that they don't want to get this booster shot going into next year?
I honestly think, the booster shots are probably going to end up like the flu vaccine. There'll be something you just get every year. My guess is by next year, if they're still necessary at this point. I mean, we need some longer term studies on the third booster now to see how long that protection lasts and how the antibodies wane. But if we need another booster, my guess is they will probably be mixed in with your flu vaccine. There's absolutely no reason why you can't receive both of those vaccines at the same time, potentially even in one shot. In fact, I believe there's one manufacturer who's already producing a combined COVID and flu vaccine. So, that's probably what will happen in the future. So I'm not too worried about that. Now, the question is, how broad will the coverage with that be? And again, I think the boosters are going to they're going to help in terms of transmission. Okay. But that pales in comparison to their benefits in terms of illness and death, which is what we're really worried about. And again, I think if the elderly get their boosters, because they're the ones who are at the greatest risk of breakthrough infections ending up in severe illness, hospitalization, or death, those are the people that we want to get boosted. And again, if we look at flu vaccine experience, generally the elderly are fairly good about getting their vaccines. Okay, younger people tend not to vaccinate for flu, unfortunately. I wish they would, it would help us a lot. But the elderly tend to be, I think, pretty good about their vaccines. Our health system really promotes those vaccines for the elderly. So again, I think, as long as it becomes part of the integrated health system, I'm not too worried about it getting to the elderly in our population, who are the ones who will most need it. Because what they found in Israel is that the booster has reduced severe illness and breakthrough, or, severe illness by about a factor of 10. Okay, so it's made a big difference in terms of the amount of severe illness occurring, and it also boosts the protection against infection back up again. So not only are you more protected against severe illness, you're also protected more against infection. So there are real advantages to the booster, especially among those who are older and who will have more waning immunity. Your immunity does wane faster when you are older. Your immune system gets less solid. Your immune system weakens, which is why older people tend to get sick more easily. And so I do think, as long as we build the boosters into the system, we'll be fine.
I want to bring in this question from James, who says, can you comment on the relative effectiveness of the two primary vaccine mandate options, vaccination versus regular testing? Should we be using both? What about this idea of people being given the choice there? And what do you think of James's question?
I think vaccination is by far the preferred approach. Testing is not widely enough available at this point in the islands, nor are rapid tests as available as they should be. Honest truth, the only way that we should be allowing exceptions to the vaccine requirements for entering establishments should be if you take a test on the spot. And that would require basically having rapid tests. The rapid tests are extremely good at picking up people who are infectious. Okay, we hear some complaints that, oh, they're terrible for diagnosis and so on. That is not what rapid tests are intended. They're not intended as a diagnosis tool. They're not intended to catch every possibility of COVID. What they're intended to catch is people with infectious COVID, whose viral load is high enough that they could potentially transmit to other people in a workplace setting or another setting. And so what we really need is not just or testing. It needs to be or daily testing going into any public setting or public workplace. And I think that's what the testing requirement should be. Testing once a week, I honestly don't see as being all that protective, to tell you the truth, because you could get infected on your way out of the office after your test. And then you would actually, the time you then go into the office 2 or 3 days later, once you get your test results back, is probably when you're going to be peaking in terms of infectiousness. So to me, testing makes sense with rapid test. Doing a PCR test 2 or 3 days in advance doesn't really help us very much, I think, in terms of prevention.
I want to take a deeper look at what we're seeing in our communities here, and specifically when we look through the different islands. Of course, we know there is this vaccine verification that has been in place. Safe Access Oahu has it. Maui has also implemented it. But we're looking, when you look at the islands of Kauai as well as on the Big Island, they do not have this vaccine verification. And we're seeing lower numbers on Kauai, but the Hawaii Island continues to have a significant amount of positive cases, as well as their hospital load on the Big Island at Hilo Medical Center continues to remain relatively high. What can you tell us about what we're seeing on the different islands and how this vaccine verification program has an effect on that?
Well, I think the vaccine verification program does have an effect, because if you actually look at the fact that only 10 to 15% of our infections here are breakthrough infections, okay, that's telling us that vaccines are about 90% effective, that they're actually working fairly well against infection. Okay, they're keeping people from getting infected. And that means if I've got all vaccinated people within an establishment, their risk of contracting COVID, even if another vaccinated person who's infected comes in, is still going to be a factor of 9 or 10 lower than it would be if they were unvaccinated. Okay, so we radically reduce that. In addition, the vaccinated people are less likely to get infected in the first place. They're only 10% to 15% of our total infections. So number one, they're less likely to be infected going into the establishment. They're less likely to transmit or to contract COVID when they're in the establishment. So it's like a double win in that regard. And I do think it helps to make the indoor spaces much more safe. They're still not 100% safe. Nothing is 100% unless you're, wearing your mask, keeping your distance, and so on. But those indoor spaces are much, much safer, I think. And we see that, if you look at the cluster reports for Oahu, the restaurant-related outbreaks are way down in the cluster reports. I think there was one in the last cluster report. And like I say, if you go back about a month and a half, we were looking at typically something like 5 to 8 restaurant-related clusters of one form or another. So I do think it's making a difference.
I want to ask you about the folks who are not vaccinated. You mentioned that we have relatively strong numbers. Over 90% now have at least initiated vaccines. We're talking about people who are eligible. This is not counting those under the age of 12. But if that 9% or so continues to hold out, what does that mean for the long term of the virus in our community?
I don't think in the long term it's going to have all that much effect. I think fundamentally we just have to accept the fact that Delta is eventually going to get virtually every one of them. The problem with Delta is contagious enough that basically if they are unvaccinated, unless they've got an incredibly strong immune system that can fight off COVID by itself, they probably will contract Delta at some point. Okay, and at that point then they will get the natural immunity that comes post a COVID infection. It's actually not quite as strong as the vaccine-related immunity over the long term, but it's good. And it will prevent them from getting severe illness and death in the future. That's a very good thing. And so they will then end up contributing to our protected population that has much less chance of contracting COVID and also much less chance of getting severely ill from it. So I'm not too worried about them in the long term in terms of the effect that they're going to have. They will probably lead to sporadic outbreaks of COVID, especially in their own networks. I mean, like most social networks, people who don't vaccinate tend to run in groups. Okay, humans, we're group-oriented animals. We basically tend to stay in groups. Okay, so they are probably part of a group of a large number of people who don't vaccinate. So if it gets into one people in that group, it's probably going to spread to a lot of the others. So we're probably going to see sporadic transmission clusters that are occurring basically do this. Now, what I'm really worried about with them is more the impact they could have on our hospital system. Okay, if we take, say, 140,000 of those people who are, not vaccinated at this point, kind of disregarding the children as, less likely to suffer severe illness and death, then of those 140,000, like Josh Green has pointed out, about 4.5% of them will probably end up in the hospital at some point. Okay, that's another potential 6,300 hospitalizations over whatever period of time it takes to get those people infected. Okay, now, what effect that has on our hospital system depends on how those infections occur. If they're spread out over time, I think it'll have minimal impact on our hospital system. There'll be 10, 15 more people in the hospital with COVID than there would have been otherwise, and our system can manage that. If it occurs very rapidly, for example, if we drop all restrictions too quick and these people get infected very rapidly, then we could see another spike in hospitalizations. And that I would worry about. And the other third possibility I would worry about is if they start getting infected at the same time that flu starts spreading in our community, because flu already taxes our hospital system in a normal year. Fortunately, it didn't last year because of the COVID restrictions. But if we have flu and COVID co-circulating and both generating hospitalizations, again, we could see a taxing of our hospital system once again. So I really worry about it more from that point of view than I do about, altering the overall dynamics of the pandemic here.
Well, we know that you are more of a scientist than a psychic or a fortune teller, but just looking forward into the future, what do you predict will happen? What will things look like, say, around the holiday season and going into next year, specifically here in our islands, based on what you've been studying and what you know right now?
Well, I think our current drop is probably going to continue for another couple of weeks because I think restrictions are in place. People are being careful still. The numbers are coming down. I suspect that trajectory will continue. And then we'll probably stabilize, I don't know, anywhere from probably 40 to 50 infections a day, which is, sort of where we were before the Delta spike. And we'll probably settle into something like that, which means that COVID is circulating around the community. It's being kept alive by the unvaccinated population and some of the vaccinated people who have contracted COVID as well. Okay, so there are pockets of it that will pop up from time to time. School children are getting infected at a much more gradual rate, but again, the fact that some of them are getting infected will help to keep it alive in the community. So it's still going to be there. And then it's going to be a question of whether we give it opportunities to spread. It's how we lift our restrictions. I think if we lift our restrictions carefully, we probably won't see another major outbreak. We may see some upticks and some spikes, but they'll probably be relatively short-lived because the susceptible population is comparatively small at this time, even though Delta is very, very contagious. So I do expect that, we'll probably enter a low period. Now, the holidays are exactly what I worry about, because going into the holidays, people tend to let down their guard. They throw the mask away. They worry less about whether or not people are vaccinated coming into their holiday parties and so on. And that then gives the potential for spread, especially if people are getting together in large extended family groupings now, and if people are traveling from the mainland. Okay, I think let's not underestimate the impact that the mainland can have on us. A lot of people now are talking about, the media pundits are talking too much, I think, about the fact that, oh, the COVID peak has passed, we're in decline. Yeah, that's true in the South. That's true in some parts of the country. But if I actually look at the upper north and the Northwest, at this point, COVID is actually increasing in virtually all of those states: Michigan, Pennsylvania, Minnesota, those states where it's getting colder now, and people are starting to move back indoors, we're starting to see the COVID numbers go up in those states again. Those states send us tourists. The snowbirds, right? They want to get away from the snow. They want to get away from the ice. They want to come to Hawaii where it's nice and sunny. Okay. So the potential for reintroduction of COVID from those areas, I think, is a very real one. So we do need to be concerned about that. It will still be circulating in our community, so there's always going to be some here. But again, that's why I'm cautious about lifting restrictions too quickly. I really hope that we keep, for example, masking restrictions in place at least through Christmas and New Year's, because I think that's the big danger period right now for us. That's where we're likely to see much wider spread, and all it takes is a couple of super spreader events, large Christmas gatherings, for example, large Christmas parties of 100, 120 people. That could easily seed COVID into the community again, and then a lot of those people who are protected by vaccines might still see breakthrough infections. They'll be mild, they won't tax our hospital system for the most part, but they'll still contribute to spread within the community. So again, I'm going to recommend a cautious approach going forward here.
Okay, well, the top of the hour is here. It hits us so fast. Thank you so much, Dr. Brown, for being with us. We really appreciate all of your knowledge this morning. It's really great to hear from you.
My pleasure. Great talking with you again.
Aloha.
Thank you. Well, you hear their cautious optimism from Dr. Brown. He's really recommending that we keep our guard up, because even though things are at a lull right now, the virus is still in our community. Delta is still very strong and immunity is waning. So some warnings there, even though there is some good news as well.
And you hear him talking about the importance of lifting the restrictions strategically, not lifting them all at once. And he believes that if with a tiered approach and a measured approach at lifting the restrictions, that we will be able to see the numbers that we're seeing right now, not really seeing any surge. We may, as he said, say a few spikes, but nothing to the point of what we saw just a month ago. But so he's, hopefully urging lawmakers and decision makers to ease restrictions with caution and not necessarily open everything all at once. Also bringing up some interesting thoughts about boosters. I thought it was interesting to hear of that combination potentially of a flu and COVID booster all together, essentially a super booster of flu and COVID together, and how one manufacturer is actually already looking at that moving into the future.
Yeah, a single shot would be very nice, and it would take a lot of the sort of politics, I think, and guesswork out of it, because you would just get that one shot, and there would be less discussion and less questioning of getting that shot. But we know that it's always great to hear from him. If you missed any part of the discussion, go back to the beginning. Remember, we're also a podcast, so if you want to wait till the afternoon and download this anytime, you can do that wherever you get your podcasts. I also thought it was very interesting that he said that the weekly testing that is an option for those who don't want to necessarily get vaccinated, he thinks is not very effective and is still a way for the virus to spread. And that if it were up to him, he would bring back pre-travel testing in addition to the vaccination requirement. One person who, of course, oversees that program is Dr. Josh Green. He's doing his ER shift on the Big Island today, so that's why he's not with us, but he will be joining us here on Wednesday. And we'll ask him about safe travels and the vaccine rollout, see what he thinks about lifting restrictions and perhaps adding that measure back when we think about all those snowbirds who will no doubt be coming to Hawaii for the holidays.
Yeah, no doubt. A lot to talk to him about on Wednesday. We encourage you to join us once again here at 10:30 for another episode of Spotlight Hawaii. Until then, stay safe and take care. Aloha.
Aloha.
This episode of Spotlight Hawaii was brought to you by Chaminade University.